More and more police stations are having to close their doors, albeit temporarily, because of COVID-19 infections, but the public has been urged not to panic. Authorities are saying measures are in place to ensure that services will not be interrupted. Here's my colleague, ENCA's Barry Bateman.
It seems no service or industry has been spared the impact of COVID-19. And essential services are no different. With the country gripped by a surge in cases, more police officers and the stations they're attached to have been affected. But will communities be left vulnerable and without boots on the ground?
When a police station does close down, this could vary from about 6 hours to about 24 hours at a time, where of course the decontamination process takes place. We then have to move members to maybe a nearby building, or mostly mobile units that's set up just outside this affected station.
And those keeping a close watch on the men and women in blue confirm the police's contingency plans have so far proven effective.
From the feedback we're getting from the ground, there seems to be adequate measures in place to deal with day-to-day policing.
If a police station like this one is cleared of personnel, there would be no one available to answer the phones. What then?
In case of an emergency, call 10111 and you'll be able to get some help.
Just like the public, police officers are also subject to quarantine requirements if they test positive for the virus. Police say the growing number of affected officers is a concern, but it is nowhere near a level that has impacted their ability to render a crucial service. Barry Bateman, Pretoria.
Meanwhile, the Police Minister, Bheki Cele, is concerned about the rising number of police officers who have contracted COVID-19 in the Western Cape.
We have enough PPEs at the present moment, but PPEs is a continuous battle that now and again you need to have them. I haven't heard that there is a place where we are running short. The South African police, I think there are 4,000 now, over 4,000, but the number of Western Cape still worry us, because in that 4,000, we are 1,700 in Western Cape. Out of 28 deaths in the members of the South African police, 16 comes from this province. So we are quite worried about this province. And indeed, it's beginning to move to Gauteng, because the whole society, we are part of the society. So what society suffers as the members of the South African police suffer. But when it comes to PPEs and when it comes to our members, one thing that we have requested, especially with the Department of Health, is that if they can regard our members as the frontline workers, don't keep them too long, their results and all that, so that if they are fine, they're negative, they go back to work. But if results take too long, yet you are positive, which means you are spreading it before you know. So those are the things that, and health, unfortunately, fortunately understand that police and law enforcement, in terms of the South African National Defence Force, Metro and everybody, we are part of the frontline workers.